some of that noise, but increasing that signal is helping to compensate for that noise. Does that make sense? The window, construction outside, right? Windows closed, we don't hear anything. We open it a little bit, we can hear some of the construction. We open it all the way, we get all that noise. Okay, so the same thing here. So as the window narrows, less noise is detected. As the window widens, more noise gets detected. However, you're going to get with that, you're going to get more signal. So you reduce the receive bandwidth, decreases the amount of noise sampled. This increases the amount of signal that is sampled relative to noise, and it will increase your signal. But when you have a patient that has all that metal in there, it's almost like you have to increase your bandwidth. Okay, so let's take, for this purpose, let's take the metal out of it for just a minute. When you reduce the receive bandwidth, it decreases the amount of noise, just like the window, right? This increases the amount of signal relative to the noise, and it will increase your signal to noise. So it's actually an indirect relationship. If you cut receive bandwidth in half, you increase the signal by 40%. Okay? Because remember, closing that window, you're getting less noise come in. So it's an indirect relationship. It's not a direct relationship. So you would think, open it, wide up, and will increase your signal. No. When you has anyone heard of MARS, the MARS technique, metal artifact reduction software? It's special software that you can purchase for your system. I think Jupiter may have it. I'm not sure.
They're trying to get it, but it's expensive. So.
Yeah, it's very, very expensive. Those, basically, when this technology was starting to come out, our apps people told us, just increase your bandwidth. Open that wide up, and that will help. And it does. It reduces a little bit of it, but it doesn't do near what Mars can do for you. The Mars it's a special pulse that is set on top of everything that helps to minimize it. But those pulse sequences are like 10 minutes long. So if you're doing a patient that has a shoulder or knee or hip, take your 30 minutes or your 25 minutes and you can double it. I mean, when I worked, who's an independent? Is anybody an independent imager? You. Which one are you at?
Well,
okay, so the 450W, the open as they call it, has the Mars software. Have you seen?
I'm more in the club, but I'm going to go check it out.
Okay, yeah. That magnet, they purchased the Mars, and when I was working there, and we would do a shoulder or hip or a knee, it would take almost an hour because the pulse sequences were like 10 to 12 minutes long. They were insane. But again, it's a price you pay. And it really helps clean it up though. I mean, they really, really look good. So for us, when we touch the received bandwidth, and when you increase, when you reduce the received bandwidth or make it shorter, it decreases the amount of noise and it increases the amount of signal. Cutting receive bandwidth in half increases your signal by 40%. This is another thing that's going to be on the board. All these numbers for signal. Double your field of view. Increases your signal by a factor of 4. Okay? What's the other one? Slice thickness.
So what do you mean by the receive bandwidth in half? Like if you have a 5 and you go from a 2.5?
No, you would never be that low. Typically, most bandwidths are 20 to 31. If you look at your protocols, they're usually around 20 or 31. What this is saying is that if you cut it in half, it will reduce your signal by 40%. Okay? So bandwidth is one of the things that I try to stay away from. I look everywhere else before I go to bandwidth. Okay, because with the bandwidth, your noise, you can increase your noise. So you have to be really, really careful with it. And if you cut receive bandwidth in half, it will increase your signal by 40%. So it's telling you to use the smallest bandwidth. Don't drop it all the way down because, again, even though you're decreasing the amount of the noise, you're still messing with how much signal you're getting in there. Okay, so that one's kind of one to stay away from because, again, if you cut your bandwidth in half, yes, it will increase your signal, but it depends on where your number is. So that's really not one to be looking for getting signal. You want to look more for your matrix and your NEX, those type of parameters instead of going to bandwidth. So field of view, double it, increase by a factor of 4. Next,
1.4.
double it, increases by a factor of 1.4. Bandwidth, if you receive bandwidth in half, you will increase by 40%. Okay? Coil selection, so important. I know we think it's kind of like not that one of the most important things, but it really is. Your coil selection and your placement. You want to make sure that that body part is placed in the center of the coil. General rules of thumb, use the smallest coil possible, and the region of interest should fit in the sensitive area of the coil. Where's the sensitive area of the coil? The center. Like when you do a knee, you want to make sure the knee is right in the center of the coil. If the patient's too far in the coil or not far enough in the coil, what happens? You're going to cut off anatomy, but when you're looking at it, how does it look when it's cut off? Right, you have a decreased signal, so if the knee's not properly centered in the coil, you may not get all the anatomy that you need to have on there, okay? So coil selection is very important. Again, you're not going to use the head coil to do a wrist. You're going to try to do use an extremity coil or a dedicated wrist or elbow coil, whatever the facility actually has. So, some tips to optimize our signal. You want to use spin echo sequences when possible, right? Why? To clean up the crack. We want to avoid short TRs and long TEs. So we want long TRs and short TEs, right? Why do we want a long TR?
Recovery.
For maximum recovery, right? Long TEs, or short, why do we do a short TE? What is TE?
As long as you
For T2 for the decay, right? So we want to use the shorter the shorter TEs and longer TRs. We want to select and place our coils carefully, right? Not just throw the patient in there. We want to use a coarse matrix, which is what?
higher signal.
Give me numbers. One of your numbers.
128 by
128 by 128, right? So you want to use the smaller numbers to increase your pixel size. You want to use a large field of view. Again, you're not going to get carried away with that because you want the field of view to cover the anatomy that we need. We don't want to have the field of view this big and have the image teeny tiny, okay? Thicker slices. Sometimes we have to use thinner slices to cover smaller structures, okay? When we use thicker slices, we lose resolution, right? We use the thinner slices for the smaller anatomy to get more spatial resolution. And use multiple necks. You want to try to increase your necks. So again, these are tips to use for signal. Do you see bandwidth up there? No. Try to stay away from bandwidth if at all possible. I mean, it is possible. You can try to use spin echo full sequences. What is even better than spin echo? Fast spin echo, why?
Because it follows 180.
Multiple 180s, right? The more 180s, the more crap that gets cleaned up. However, we haven't got there yet, but you have to be really careful. What is the parameter that controls how many 180s? Anybody? On GE. Yep, echo train length. Okay, so has anyone seen that on there? Look at on your fast spin echo, you'll see echo train length, and you'll see obviously anywhere from, if it's one echo train length, what is it? It's just a spin echo. So you're never going to use one, right? So it's going to be 2 or greater. But as you increase your echo train length, you're going to increase blurriness. So you have to be really careful with that. Okay, and also echo train length, depending on if it's a T1 weighted or a T2 weighted. Your numbers for T1 are going to be low, usually around 4. That'll be like your kind of your ceiling. T2, proton density is like 7 to 10, and then T2 is 12 and up. And we'll go over that more as we move along. That's not going to be included in this test. That was just a little sidebar to throw at you guys. Another parameter for you to look at. Okay, as you increase your echo train length, it does help to decrease your time. But it does have to have ceilings for your T1, your proton density, and your T2. So if I'm doing a T1, I'm not going to use an echo train length of 15. I'm going to keep it really low, and we'll go over why we have to do that in the future. Questions? He's like, I think we covered all of these. We hit them pretty hard tonight. When you guys go to clinic, be more aware of your parameters now that you know what they do and what happens if you increase or decrease them. And for those of you that are not on GE, look to see where it says what your signal is. Okay, if it increases it, when it increases or decreases it. I worked on Philips years ago, and there was a little thing on the bottom that would tell us the signal. Questions? Somebody shoot me a text message tomorrow. Check Blackboard and let me know if that.
It's on there.
It's on?
Mm-hmm.
Awesome. Okay, good. All right, guys, so there's a second part to parameters and trade-offs that you can now review now that it's on Blackboard, and we'll go over that next week. Questions? Pretty good?
Oh, no, I got
All right, excellent. You guys